everyone, welcome back to my channel Dental Cafe. If you are new to my channel, then don't forget to subscribe and hit the bell icon for the latest video. So today I'm going to discuss about the implants in general. Okay, then let's begin the video. What is dental implant? So it is a prosthetic device made up of alloplastic material implanted into oral tissues beneath the mucosal or and periosteal layer and or within the bone to provide retention and support for a fixed or removable dental prosthesis. A substance that is placed into and upon the jawbone to support a fixed or removable dental prosthesis. So basically it is an alloplastic material which is placed within the bone or beneath the mucosa to support a fixed or a removable dental prosthesis. As the definition suggests that it is of two types. It can be fixed or it can be removable. So fixed, as we all know, in cases of fixed we have a fixed bridge, full mouth rehabilitation, and in removable cases we have overdenture or bar supported overdenture or stud supported overdenture. So in the first figure we can see we have a complete denture replaced by implant supported overdenture, and in this figure we can see a bar which supports a denture. In second figure we have an implant supported bridge or fixed prosthesis. Okay, why we choose dental implants over dental bridges? So there are many reasons to choose dental implants over dental bridges. Some of them are, as we know, in case of fixed bridges we need to do a tooth preparation of the adjacent tooth. So no damage to the adjacent teeth in case of implant. There is a bone maintenance. Implant will maintain the height and the width of the bone. Then in distal end situation or multiple missing teeth or long span edentulous, it is impossible to give a fixed prosthesis without implant. And complete edentulous situation, we can give overdentures. So begin with the classification of implant components. We have two types of components. First is a main components and then we have accessories. In main components we have fixture, abutment and superstructures. In accessory we have surgical and the prosthetic parts. In surgical we have a cover screw, gingival former. In prosthetic part we have implant, analog and impression post. I'll discuss about each and every component in detail in the later slides. Look at the figure. We have implant fixture which is placed beneath the mucosa or within the bone. The coronal part of the implant fixture, which is smooth, is called collar or CREST module. And then we have an abutment which is secure with the help of screw, and then we have a prosthesis or a crown which can be screw retained or a cement retained. Types of implant body design, we have three types: cylindrical, screw, and third one is the combination of cylindrical and screw. So cylindrical is also called press fit, which are usually pushed or tapped into a prepared bone side. Because cylindrical design is smooth one, it has no serration, so it is tapped or pushed into a prepared bony side. We have a screw one which are threaded into a slightly smaller prepared bone side. A slightly small prepared bone side because they get snugly fit into the bony side. If the osteotomy side is wider, then it is not snugly fit into the bony side. So we have slightly smaller prepared bone side, and they are not tapped or pushed because they have threads, so they are just tightened over the prepared side. Third one is a combination one. It is a combination of cylindrical or screw form. It means it is a cylindrical but it have threads. So begin with the first component, that is implant body or the fixture. Look at the figure. We have a smooth surface of the implant which is we call collar or the CREST module. Then we have a blunt apex, and then implant, fixture or body. So first of all, length of the implant body, it should range from 7 to 16 mm, depend upon the site whether it is anterior or it is a posterior region. Then implant body is a portion of dental implant that is designed to be placed into the bone to anchor or support the prosthetic components. I think it is very clear. Then what is CREST module? Portion designed to retain the prosthetic component in a two-piece implant system. It consists of platform and anti-rotation feature. So it is smooth because if the surface of the CREST module is rough, there is more chances of plaque accumulation and the prosthesis failure, and that is why the coronal portion of the implant is smooth, which is called CREST module, to prevent the attachment of the plaque. Function of CREST module: to reduce bacterial invasion as it is smooth, to prevent the plaque accumulation, offer resistance to axial occlusal loading, provide a precise fitting for abutment on fixture. Cervical collar: when the CREST module is smooth, polished matter, it is often called the cervical collar. Function: allow functional remodeling of bone, improve abutment fixture interface, prevent exposure of surface coating. Then apex of the implant, it should be blunt, not sharp. Apical end of each implant should be flat or round rather than pointed, because if an opposing cortical plate is perforated, a sharp V-shaped apex may irritate or inflame the soft tissue. That is why apex must be flat or rounded. Now, what is pitch and threads of the implant? Look at the figure. The serration we have is called the threads, and between the two threads the area is called a pitch. If more the threads, then we have a more pitch. If we have less thread, means we have less pitch. So implant with more thread are preferred as compared to the implants with less threads. More the threads, more will be the anchorage with the bone. Now the next component is abutments. Is defined as a portion of tooth or that portion of implant used for the support of a fixed or removable prosthesis, and it ranges from 1 to 10 mm. As we know, we have a fixture or an abutment, and a part of the prosthesis which seated over the implant is called abutment, which can be screw retained or a cement retained. Then we have a classification of abutments: abutments for fixed prosthesis and abutment for removable prosthesis, that is over dentures. So abutment for fixed prosthesis, in which we have definitive or a provisional or temporary abutments. In definitive, again we have two types: either it's prefabricated or it's custom made. Then in abutment for removable prosthesis, we have various attachments like stud, bar, magnetic and telescopic attachments. Look at the first figure. We have prefabricated abutment. It means there is no need of casting, just a prosthesis is cemented over the abutment. Second figure, we have a castable abutment, in which we have a two part. One is a plastic sleeve and second one is the screw. So plastic sleeve is casted with the help of lost wax technique, and over which prosthesis is fabricated, which is screw retained. So difference between both is the prefabricated and the castable is the prefabricated one is the cement retained and the castable abutment is the screw retained. Now abutment for removable prosthesis. So first one is the stud abutment or attachment. As you can see in the figure, we have an implant and then over which we have a stud or o-ring attachment, over which the removable prosthesis is fixed. Next one, we have a bar abutment or attachment. So look at the figure. In figure, as you can see, we have a bar. This bar is castable, So in the first figure, as you can see, it is in form of plastic. So this bar is castable. After casting, it is attached over the implant, and then we have a clip which is in the denture to keep the prosthesis in a place over the bar. So we have a clip which is placed within the denture, and in the first figure, as you can see, we have a clip. Clip can be of plastic or of metal. We have a magnet attachment or abutment. Look at the first figure. We have a magnet placed over the implant in the mouth, and in the second figure, as you can see, we have a paired magnet with opposing pole facing each other so that it can attract each other when placed in the mouth. Then we have another classification of abutment. So abutment for screw retention, in which screw is used to retain the prosthesis or superstructure. Then abutment for cement retention, as the name suggests, cement is used to retain the prosthesis or superstructure. And then abutment for attachment, used as an attachment device to retain a removable prosthesis. For example, we have O-ring attachment, stud attachment, magnet attachment, or bar attachment. All these are abutment for attachments. Figure, we have a abutment for screw retention, used for the screw retain bar or fixed prosthesis. Then in the next figure, we have an abutment for cement retention. Third figure, we have abutments for attachment, are used for removable prosthesis that are implant retained. Okay, abutments can be straight or angulated. As you can see in the figure, angulated abutment are used in case of angle correction. If implant is malpositioned, to correct the position of the implant, we'll choose angulated abutment instead of straight. The next component is cover screw, also called healing screw. After surgical placement of implant, screw is placed to cover the connection for abutment during healing period. So cover screw is used at a time of first stage surgery and removed during second stage surgery, and then gingival former is placed. So look at the figure. We have a cover screw, we have implant abutment interface, then we have implant collar, and the last part is the fixture. As we know, cover screw function, it facilitates the suturing of soft tissue in two-stage implant, minimize loading in one-stage implant. Now the next component is gingival former, required only for two-stage implants. Following the second surgery, to expose the implant, the cover screw are removed and gingival former are placed on fixture. Form gingival cuff around the implant and it is placed for 2 to 5 weeks. Look at the first figure. We have a gingival former which is placed over the implant at the time of second stage surgery, and it will result in formation of gingival cuff or soft tissue profile. So the function is extend above the soft tissue in the oral cavity and form a gingival cuff around the implant. Next component is impression post or impression transfer, abutment or impression coping. Impression post is a component that is used to transfer the implant hex position and orientation from the mouth to the working cast. We have two types of impression coping: open tray impression coping or post, or closed tray impression coping or post. Open tray impression coping have deep retention grooves along its body and a long connection screw. This post is used in open tray impression transfer technique. All these techniques I will discuss in my next video. So look at the figure. We have a long screw in open tray impression coping and we have a deep grooves. Then we have a closed tray impression coping. It have shallow retention grooves along its body and a short connection screw. It is used in closed tray impression transfer technique. As you can see in the figure, there is no long screw in closed reimpression coping, and the grooves are also shallow as compared to the open tray impression coping. Function of impression post or coping. So it provides special relationship of endosteal implant to the alveolar ridge and the adjacent dentition, and facilitates transfer of intraoral location of the implant or abutment to a similar position on the laboratory cast. And the second point is very important. Last component is implant analog. It is a replica of entire human implant, not intended for human implantation. It is fitted to the analog and prosthesis is fabricated in the laboratory. Also called implant replica or lab analog. And the function of the implant analog is used in the fabrication of master cast to replicate the retentive portion of the implant body or abutment.